Welcome back to The Explainer. Today, we're diving straight into the actual timeline of the G-shot procedure. We're going to use real clinical data to unpack exactly how long this process takes, from the second you walk in to recovery, and how long the results actually last. So, if you're the kind of person who needs to know the exact logistics before trying something new, you're definitely in the right place. Okay, so here's the ultimate question, right? How much time does sexual rejuvenation actually take? I mean, we're all juggling incredibly busy schedules. It's totally natural to wonder if you literally even have the time to commit to a treatment like this. Let's look at what this timeline actually demands of your day. And the answer is a pretty surprising 15 to 30 minutes. Yeah, seriously. It's fascinating because clinical sources consistently call this a lunchtime procedure. That brief little window is all it takes for the whole appointment, so it easily slots into a crazy workday. Moving on to Section 1, Understanding the G-spot. So just to get us grounded, the G-spot, or Grafenberg spot, is a highly sensitive erogenous zone right on the anterior or front wall inside the vagina, and it's actually intimately connected to the clitoral network. The whole point of this procedure is to target and amplify the sensitivity of this specific spongy tissue. Section 2. What exactly is the G-shot? Well, medically, it's known as G-spot amplification. Notice the absolutely crucial word here, non-surgical. This is a cosmetic treatment that uses hyaluronic acid-based dermal fillers, and they're injected directly into the G-spot. And because hyaluronic acid naturally occurs in your body anyway, the risk of having an allergic reaction is just extremely rare. The physical goal is actually really straightforward. The filler bumps up the size of the G-spot to roughly the size of a 5p coin. It thickens the tissue so it projects a bit lower into the vaginal canal. Mechanically speaking, this just makes the area way easier to stimulate during penetrative intimacy, which aims to heighten arousal and orgasms. Simple as that. Great, let's hit Section 3, the clinic appointment time. Okay, let's dive into this slide and break down those minutes spent in the chair. Step 1 is a quick consultation and examination to find the absolute optimal target area. Step 2, they apply a local anesthetic, usually lidocaine, to numb everything up. And finally, Step 3 is the precise injection of that thick hyaluronic acid gel. Now, here's the wild part. While the whole appointment is maybe 30 minutes, the actual injection duration, that takes literally a matter of seconds. In fact, one of our clinical sources hits the nail on the head right here. Right here. The whole procedure takes approximately 15 to 20 minutes. So from walking through the clinic door to heading back out, it's an incredibly efficient process. It's tailor-made for people who just do not have time to waste. Section 4, Recovery and Immediate Aftermath. So what happens after? Well, our sources show that strict downtime is basically zero. You can get right back to your normal daily activities the second you leave. You just have to plan for a couple of immediate things. The numbness from the lidocaine will take a few hours to wear off, and you might have some minor spotting. Clinics usually give you a sanitary pad to wear for about 4 hours, and then you're good to go. Now, when it comes to resuming sexual activity, we're seeing two differing clinical perspectives in our sources. Some clinics say, hey, intimacy is totally fine just 6 hours post-procedure once that numbness subsides. But other clinics strongly advise holding off for a full 5 to 7 days. That longer wait is just to let the injection points fully heal and pretty much eliminate any risk of infection. Moving into Section 5, Duration of your results. Okay, this is absolutely crucial to understand about the timeline. The results are entirely temporary. Since hyaluronic acid is natural, your body is safely absorbing it over time. And how long it lasts? Well, that depends entirely on how fast your own unique metabolism breaks down the filler. Now, what's really interesting about the slide is seeing how wildly metabolic rates can differ. Our sources give us two different ranges based on patient data. Some clinics quote a duration of 4 to 6 months, while others cite 9 to 12 months. And the thing is, both of these are perfectly accurate. It's just that your body's internal engine dictates the fade rate. So the long-term reality is that as that filler naturally absorbs, you're going to feel a gradual return to your pre-procedure baseline. The tissue returns to its normal size. To keep those amplified results going, you'll need to schedule routine top-up treatments. But the good news? Those future visits are just like the first one. Another super quick 15 to 30-minute appointment. This really illustrates the whole journey perfectly. Day 1, your quick 15 to 30-minute procedure. Fast forward 4 to 6 hours, the numbness fades. Depending on your doctor's advice, you wait anywhere from 6 hours to 7 days before intimacy. And then you've unlocked 4 to 12 months of enhanced sensitivity before you even need to think about a top-up. It just maps out so neatly.
So I'm going to leave you with this to think about. We're talking about a tiny fraction of your day here, right? It's literally the time it takes to grab a coffee and clear out your inbox. When you weigh a simple 30-minute commitment against months of potential lifestyle enhancement, it kind of changes how we look at clinical time management. Is 30 minutes worth redefining your wellness routine? Thank you so much for joining me for this explainer. Keep exploring the science of your body, and I'll see you next time.